Well, many studies show that older Americans tend to have multiple, often chronic health issues. Ironically, they tend to need more specialized care at a time in their lives when it can be much harder to get. But a group of clinics founded by a doctor who survived cancer is offering an affordable and easy option. CBS 2's Audrina Biggis takes a look.
You know, I just came back from Hawaii.
I know.
I came back and I just didn't feel good.
This may seem like the usual doctor's visit, but there's a lot more. Internist Dr. Kimberly Webb and patient Patricia Logan really know each other. And that's the plan at this JenCare Senior Medical Center in Chicago's Ashburn neighborhood.
Let me take a good listen to your heart here.
There are 125 centers like this here in Chicago and across the country. They provide concierge-like services to seniors in underserved communities.
Underserved areas are areas that are considered health deserts. There may not be a lot of providers. The patients themselves may not have enough resources. Have you take a few deep breaths in for me, Pat?
The goal is to make healthcare effective, accessible, and easy with almost all services under one roof.
This is a one-stop shop. You get your lab work, you get your doctor's visits, you get your medications, you get your x-rays, you get your consultations. I don't have to travel anywhere but that one center.
So coming here, we learned there's a lot of benefits that you might not get at a traditional doctor's office. Like there's transportation to and from your visits, and also a call once a week to make sure you have your medications.
We see our patients at minimum once a month, because most of our patients have a lot of chronic medical conditions. Just a visit every 3 to 6 months is not often enough.
We want to make sure that we're reducing their likelihood of needing any emergent or inpatient services, which is where the bulk of the healthcare costs come from.
JenCare was born when its founder, Dr. James Chen, was diagnosed with cancer back in 2003 and told he had 2 months to live. He found the healthcare system frustrating and unsympathetic.
He decided, you know, I want everyone else to experience something different, especially the older adult.
But he actually recovered and vowed to make medical care more equitable. So here's how it works. First, to be eligible for treatment here, patients have to have Medicare Part C or Medicare Advantage.
They make us their primary care provider. Then at that point, we are able to provide all of their services unless we need to refer them out for services we don't provide here.
For example, there is an X-ray lab here, but for MRI services, the team helps get patients appointments at other places.
It is no additional cost except to maybe some services like our pharmacy services, where patients may have a little bit of out-of-pocket service.
There's also a lot of attention paid to emotional and social well-being.
I-22.
Like this bingo game we happened upon.
We have line dancing classes here at our facility. We have exercise classes that, I've gone in there and I've broken a sweat. Chair exercises, a lot of social events.
But both doctors and patients told us it's really the personal touch that matters most.
We as seniors, we won't go to a doctor necessarily if we don't trust them. We won't go to a doctor that we don't like.
We're able to develop really strong relationships. We know about their family. We're very invested in not just the health care of the patient, but them as a person.
That was our Audrina Biggis reporting. To learn more about JenCare and how you can find a clinic near you, log on to www.jencareforchicago.com.